few months after having open heart surgery, you probably noticed that you are a little bit grumpy, that you are to some extent unhappy, which is obviously normal because of a lot of reasons. One of them is because you feel lots of pain, because your body is stiff, because the scar is pulling, because the metal wires in your chest are causing some discomforts. There is a lot of pressure to get rid of that sensation. Obviously, you already noticed that it is getting better over time, but at the same time, there is a little bit of guilt of being not 100% of yourself next to your friends, next to your family members. And there is a will, very strong will, to get back to the things that you love the most as quickly as possible. And your body is not allowing for that yet. Obviously, you will get to that point, but there are things that can help you to get to that point faster. If you watch me for some time already, you already probably saw the videos about the exercises in the early stage, breathing exercises, some gentle stretchings, and these things are the best things you can do in the early stages after the surgery. You really cannot handle more. Now, however, I'm 8 months after the open heart surgery, after a septal myectomy, and my body is allowing me to do much more. And it is time to prepare it for more intense things. And something very helpful is a mobility routine. Some things that you can do with the ball like that, with the roller like that, and they are very much available. You can get them on Amazon very cheaply, and they can be very helpful to help you to breathe deeper, to restore the mobility, restore range of motion, and to feel more comfort. You cannot be happy in a tensed up body. So when you take care of your body, your mood, your thinking will also improve. First thing of all, we will take care of the thoracic spine. Spine is the base of everything, so it is wise to start over there. We are going to improve the extension of the chest. So this movement, there is not much of that movement, that's true, but if it's unavailable, then no matter how much time you spend on the chest, on opening the chest, if you are here, it's not gonna work very well. I will show you two ways. The first one is about just rolling on top of the back muscles up and down, doing few repetitions of that. Obviously, you will need to engage your belly a bit to maintain the position. If you don't have enough strength to keep yourself there, you can do 1 or 2 repetitions, rest. Do it again, and rest. You lay down on the roller and you will roll up and down in between this area here. Now the second way, you can pick any spot around your middle back, around your middle lower back. Here it's not really helpful and it can be triggering for a lot of people, so it's better to stay in the higher portion of the back. You pick the spot and instead of moving up and down, you stay here and you slowly allow your back to arch. Reach the area that feels uncomfortable a bit, wait there, take a big breath in, big breath out, and come back. The stretch that made me feel alive again after the surgery was a rotational stretch of the whole spine. Obviously, it's a very global stretch, so a lot of things you can feel. You can feel your glutes, you can feel your abdomen, back. It doesn't really matter. You will feel the most tight part. To perform that stretch, you start on the ground, you bring your leg up. On the other side, along the way, you bend it. Along the way, you bend your knee, you try to reach the ground, and with your opposite arm, reach to the other side. Reach as far as you can. In the beginning, you may feel like you're suffocating, so it's better to start very easy. Take a big breath in, very passive, relaxing breath out, and allow your arm and your knee to drop slowly closer towards the ground. One more version of that stretch where you start on the stomach and you basically do the same. You lift your leg up and you move the leg to the other side of your body, and it looks like that. Now that the spine is taken care of, we will work on the large muscle here, which is called the lat. This muscle is responsible for pulling you up. Unfortunately, because of the surgery, because of the prolonged position here, your nervous system can get used to tensing that muscle here, which would not allow you to bring your arm up. This muscle would be a limiting factor. To work on that, we will stick the roller here and we will check the whole area, this whole region, from few angles. Your task will be to find the areas that feel much more tender, much more sore than the others, and then you can either hold the roller there or create a transversal mobilization. The second one is slightly more effective. And to make it a bit funnier, you can check your range of motion before and after doing that, just to see how much it helped you. Interestingly enough, I had a problem with my hand getting numb after the surgery, and with this guy I was able to find the spot that exactly was recreating that symptom and it disappeared. So hopefully this one will get better. Another victims will be our pectoralis muscles, pecs. These are massive muscles covering the front of our chest. They are the most affected because of the surgery, because we hold a lot of stress here, because we get used to this position where this muscle is shortened for a very long time. And to calm down the nervous system, to release those tensions, we will use the ball. We will do this mobilization against the wall. The position will look like that. The arm goes behind you. You will place your ball against your chest and you will tackle that ball against the wall. What you will do is that you will look for the tender, sore, weird feeling spots, and you will either hold the ball there or do some small circular movements until it relaxes. And in one session you can release 1 or 2 or 3 spots like that. Now we will be hitting very small muscles of the shoulder blade. These are called rotator cuff muscles. They are on the bone over here on your scapula, and you will look for the tender spots in this whole neighborhood. Over here, on top of this bony crest here, in that area. If you are very innovative and you really want to find a game-changing spot, you can place the ball here against the shoulder blade and look for the spots over here. After playing with the roller and the ball, lacrosse ball, it's already much better, but it can be even better. So I will show you one stretch that is, in my opinion, a game changer for the shoulder mobility. You will need any kind of stick that you are able to find in your apartment. You place your arms on the width of your shoulders. You grab the stick strongly. You place your elbows against the chair, against the table, whatever that is. And without losing the grip on the stick and without allowing your elbows to move outside, you will slowly descend down to the first discomfort. Now, you can just stay here for 5-10 minutes and wait until it relaxes, but you can do something more. The nervous system is deciding how much range of motion you have based on how nervous system feels comfortable. If you want to gain more gains from the stretching, you can do a certain trick, which is about going to the discomfort, going to the first resistance, and then in that position, gently push your elbows against the table or a chair, hold this resistance for a few seconds, 5 to 7 seconds, and relax. You will notice that after letting go, you will be able to go a little bit further, and then you can repeat the same maneuver. All right, that was the whole routine. I hope you find some value in that. I hope it makes you feel better. Leave the comment. Let me know if that was helpful, how you feel after doing all of that, and yeah, good luck with your recovery.